Good morning. Welcome to the Senate informational hearing on program cuts for female offenders. It's not exactly a terrific topic, but this is the Senate Select Committee on Women and Children in the Criminal Justice System. And I welcome all of you to this important hearing. As you all know, that we are going through a very difficult, continue to go through a very difficult year with our budget. And so we're interested in making sure that the impetus that we have started a couple of years ago regarding female offenders continues and not be sacrificed through these budget cuts. So we know also that our prison system is in trouble. Do we all know that? And in the wake of our substantial budget cuts this current year, it is more important than ever that the legislature, the department, and advocates and stakeholders really work together to find more cost-effective ways to try to prevent the system from just falling apart. And we formed this select committee to take a hard look on how women are treated, especially in the light of these budget cuts. And CDCR has estimated that the women's population in our prisons is about 6% of the total, and 85 to 90% of these incarcerated women are nonviolent offenders. And many of them have children. 70% are mothers. And many of their children end up in our foster care system. And a substantial number of these kids go on to commit petty crimes, perpetuating the cycle. And it's hoped that through hearings like this that we can work together to try to equip these women offenders with knowledge and skills and tools to lead more productive lives for themselves and their families. Today's challenge is to examine two things: the implications of state budget cuts for women rehabilitation programs as they impact inmates, communities, and families, and two, to really identify some best practices, innovative programs, and opportunities for collaboration, coordination, and partnership to avoid or minimize the impacts that these budget cuts are going to make. So the kind of rule of the day is that after our panelists have spoken and we exchange some questions and answers, the public will be allowed to come up and address myself about your concerns. And so I would like to begin. Let's just do this first with Dr. Barbara Owen from the California State University, Fresno. Dr. Owen was instrumental in creating the Master Plan for Female Offenders and will provide us with research recommendations for the treatment of incarcerated women. Welcome, Dr. Owen.
Thank you, Senator. Thank you very much for inviting me.
You need to press the red button. Yes.
I can do that.
Okay.
Thank you, Senator, for inviting me to testify on this important matter. I'm pleased to join my colleagues at the table and my many friends and colleagues in the audience in discussing this matter. To begin, it's critical to discuss these program cuts within a context. Looking at the program cuts as separate issues, I don't think moves us very far toward a solution. California, as I'm sure you all know, imprisons more people than many other states, with the United States as among the highest in the world. I'm currently working on an international initiative, which I'll talk about here in a second, but the range of imprisonment is about 3% in France up to the United States, which is in the sevens, somewhere around there. Prior to this budget crisis, as you all know, California had begun a groundbreaking process to improve programming with the institutions and to create community-based alternatives to the current policy of mass incarceration. The creation legislation in support of FOPS and a master plan that was based on sound theory and research related to improving outcomes for women, children, and their communities was the centerpiece of this reform. Legislation was passed, legislation that mandated gender-appropriate training for the staff, that mandated a staffing analysis to look at the ways in which staffing positions could be redirected, and many other components. My colleague Barbara Bloom and I have made recommendations, which I believe everyone has in the package, about moving beyond the master plan toward this end. This, however, was last year. These program cuts have eroded the strides that CDCR had begun to make, despite the mounting evidence. The evidence is clear. Appropriate programs save money in the near and the long term by reducing recidivism, by breaking the cycle of incarceration, and making communities a safer place to live. The evidence continues to mount. Interestingly enough, just last week in the CDCR Bulletin, there was a press release about the Family Foundation program and its enormous success in making a difference in the lives of women and their children. A study that I recently completed in looking at violence and safety in women's prisons in 4 states, including California, of course, demonstrates that programs make prisons safer for staff and women, and cutting programs increases the danger to staff and women. Recent evidence from UCLA shows that gender-responsive programming improves outcome for women dramatically from more traditional programs. One of the problems we have in California is that we spend more money on managing our problems rather than solving them. Evidence from a wide variety of sources shows that the environment at the institution is disintegrating. Staff are unhappy due to the furloughs. Inmates are unhappy because of program cuts. And I think it's time for the Senate and everyone who has a stake in this to visit the prisons and see the kinds of things that are happening there. I have absolute faith that the wardens, the executive staff are doing everything they can, but they can't do anything their ability to do things is compromised here. There's several aspects of respect and dignity toward women that are eroding due to these cuts. I say this simply. The California legislation has a clear choice now. One, they need to look toward solving problems rather than managing them. Crucial step is developing a rational sentencing mechanism that decreases our reliance on expensive incarceration, and to fund programs as designed that demonstrate decreased recidivism and other important outcomes. As the Chinese say, this crisis is an opportunity. We need to use this crisis to focus on identifying aspects of the master plan that can be revitalized by redirecting money. We can redirect money from the expensive hard beds and toward the community alternatives designed by Barbara Bloom, and many other documents make this statement too. The recent Little Hoover report as one. We can redirect training money toward the gender-responsive training that's required by legislation. We can review the staffing analysis and think of ways in which staffing patterns can change. We can also look at examples like at CIW, which partnered with Chaffey College in creating a 2-year college program for women there. The Department of Corrections director from the state of Michigan recently said that they're using this time of fiscal crisis to plan for more prosperous times. We need to do that as well. Doing the right thing is not a mystery. It's a puzzle, and we know the pieces. The California legislature has the opportunity to do the right thing for women and children. A plan exists. Let's assess it for now and for the future. I urge the Senate not to let all this investment go to waste, to make women offenders a priority, as they did in the last couple years. The last thing I want to say is I'm now part of a UN initiative called Improving the Lives of Female Offenders. I have a few of the books here. And I just want to point out that Thailand, a very poor country, acknowledges the importance of women and children in the correctional context and is now taking the lead in developing global standards for women offenders. The United Nations will probably be adopting this next year, and I think California has the opportunity to take the lead in improving these outcomes. I urge the Senate to make its own judgment about the right thing to do. Thank you.
Thank you, Dr. Owen. A couple of just minor questions, actually. what data that would be better for you to collect to make better recommendations? Is the state providing you with enough information?
As a researcher, always happy when people want to talk about data, but I think you do have enough data. I think if you look at work of Nina Messina and Chris Grella at UCLA on the in-prison programs, which have been cut, on the community programs, which is ongoing, and on the Leo Chesney Center, I think it's pretty darn clear what the appropriate mechanisms for program development and implementation. The problem with prison programs, not just in California but everywhere, is that of fidelity. The program gets designed a certain way, and for various reasons, some reasonable and some kind of wacky, the fidelity of the program is eroded. So I don't think we need any research to prove that treatment works. I think we need more monitoring about fidelity to ensure that things such as trauma-informed practices, such as substance abuse that's designed for women, is delivered rather than generic male-based type of programs.
And program evaluation. I mean, I was at Fresno Family Foundation yesterday, and we talked about the recidivism rate, and they couldn't tell us, how successful the program was. They knew that they had a higher percentage of success, but they didn't have data to say that, X 90% or 95% do not come back through our doors.
Well, not every program is evaluated, but programs in similar categories are. And again, I direct the Senator's attention to the news release November 5th that does discuss some hard data done on the Family Foundation program in Santa Fe Springs.
Okay.
And so I think that we can generalize from these findings. The Leo Chesney program, again,
Correct.
in a trauma-informed, gender-responsive environment, is showing some adherence to fidelity. One of the things about outcome measures, the clock has to tick. Women have to get out, and you have to see how they do.
Successful they are.
But again, the UCLA work demonstrates this to my satisfaction, and I think to the department's satisfaction, that these programs do in fact work.
You talk about the master plan, and we'll go when we come down to the folks who are implementing this. We'll kind of have a conversation down there. But what steps now for the master plan? What would you recommend that we do?
My advice, and I've talked briefly with Ms. Herndon and her staff about this, is to look at the components of the master plan and reevaluate them in light of the new budget realities, to look at the kinds of things that can be incorporated without spending new funds. Secondly, to look at how money can be directed. And then third, plan for the future when funding becomes more prosperous. But I think the master plan provides both a philosophical approach as well as details about operational practice that can be reviewed now.
Okay. Thank you.
Thank you, ma'am.
Thank you. Okay. Our next panelist is Karen Shane from she's the co-director of the Legal Services for Prisoners and Children. You're to share your perspective on how the incarcerated individuals are experiencing the cuts in our programming.
Thanks so much for having me. At Legal Services for Prisoners with Children, our mission is to advocate for the rights and needs of incarcerated parents, their family members, and people who've come out of prison. And we concentrate on women prisoners. We actually deal with all prisoners, and all of our work comes from a racial justice lens. In 1995, we were part of filing a lawsuit against the California Department of Corrections on behalf of all women then incarcerated in the state prison system. The lawsuit was based on the fact that medical care at that time was so horrible for women that it amounted to cruel and unusual punishment and therefore was unconstitutional. We prevailed in the lawsuit. Unfortunately, the conditions continued pretty much the same until recently with the Plata lawsuit that I'll be talking about in a minute. But essentially, while the CDCR, who at that time was CDC without the R, states that medical care is within the realm of constitutional care, the courts are continuing to rule otherwise. So we're in a situation where the federal court has ruled that CDCR must reduce its populations by thousands of people in the next 2 years. At the same time, we're faced with this huge budget crisis, and CDCR has been told that it must reduce its budget by $1.8 billion. So while that seems like an enormous reduction, and it is an enormous reduction, compared to the amount of reduction that is happening outside of the prison system, to the general public education system, to higher education, to social services, to health care, we see that the problem that we're facing is not something that only stands within the prison system, but it's something that has come across the entire state at this point. So then we look at what California Department of Corrections has done with its budget cuts. And that's where I think we come to the problem, because the vast majority of the cuts have come to programs, as we all know. And these are programs that might actually, they have a chance of making a change, making a difference in people's lives at the time when they're released. And let's not forget that most people do get released from prison. The areas of cuts include education, anger management, drug treatment, parenting classes, and vocational rehab. These things are so bad now that people will have very few skills and tools to reenter when they do get released. And if the state, including the CDCR as well as the legislature, were truly interested in slowing down the incredible growth of the incarceration industry, they would surely not eviscerate the programs that are most likely to provide people with the tools that they will need to compete effectively with the hundreds of thousands of other people in our state who have also lost jobs during this current depression. A few years ago, Speaker Karen Bass sponsored a bill that was passed that allows people who receive cosmetology training to actually gain a cosmetology license at the end of that training. This is the only program that has existed in the state where people are actually able to get a license to do a trade that they learned that needs a license while they were in prison. But what are they going to do? What are people going to do with this cosmetology training if there's no cosmetology classes anymore? The cynicism that we're facing at this point is really quite overwhelming. The governor's plan states that if people complete their programming, then they can get their sentences reduced. And that it's a great incentive. People want to do programming, and they certainly want to get out of prison. But how are they supposed to do that when the very programs are getting cut that would let them have their time reduced? It's a catch-22, and it's a situation that we don't know what to do with. It's, what is the point of promising release if there's no way to effectuate that release? Then we look at incarcerated parents, who are very close to our hearts and we've been working with for many, many years. They face extremely strict timelines in order to maintain their parental rights. In California, prisoners have to fulfill all of their parental reunification requirements within 2 years if they're to have a chance of being able to get their parental rights reinstated once they get out of prison. In order to fulfill those requirements, they have to do what they're supposed to do, among which is to take these parenting classes. In the women's prisons, as you mentioned, where over 2/3 of the people who are incarcerated there are parents of independent children, often the sole caregiver of those children, and many of them, those children are then forced to go into foster care. The parenting classes already were few and far between. There were already huge waiting lists in order to get in them. It's cruel to cut those parenting classes even further, and it makes no sense since these parents will no longer have access to their children, who will then continue to go through the foster care system. And then finally, in the meantime, reentry is becoming more and more difficult. I mean, we're looking at a perfect storm here. Because it's perfectly legal to discriminate against potential employees on the basis of their criminal records, people who are coming out of prison now are facing even greater odds than the population as a whole to become chronically unemployed or at best underemployed. And I also want to talk about older women, many of whom have served 20 years or more as a result of defending themselves or their children against abuse. Many of them are doing long-term sentences and are serving life terms with or without the possibility of parole. I'm talking about the woman who's already served 25 years in prison, has never received one disciplinary write-up, has gone to the parole board over 10 times, has been approved for parole for the past 8 times, and the governor vetoes her release every single time. She lives in the skilled nursing facility at Central California Women's Facility and must receive breathing treatments several times a day. She sits in a wheelchair. At her last parole hearing, they had to
keep interrupting the parole hearing in order for her to take her breathing treatments so that she can continue on with the parole hearing. What is the point of this? What are we doing here? There's a woman who I've met who's paralyzed from the neck down, can't possibly do harm to anyone ever again, who also lives in that same skilled nursing facility at CCWF. And she will never come home because of her sentence. There's a woman who's been released for over a dozen times, and every single time her release is, she's been approved over a dozen times, and every single time her release is vetoed by the governor. This is a system that it's designed to create the most hopeless situation amongst the people who are the least likely to create a problem when they get out and are far more expensive than any other prisoners that we have in the system. So, what are my recommendations? We have to think out of the side of the box. We can't expect to reduce the prison budget by just cutting one program after another. We can't pit these programs, which are all already underfunded, but we can't pit them against each other. It's not as if, well, let's raise the education budget and lower the voc rehab budget, or let's get rid of parenting classes so we can keep the anger management classes. These are all things that really need to stay there. And we're being driven both because of the federal lawsuit, which was requiring a reduction in population, and because of the requirements of the budget process, which, frankly, the only way to reduce this budget is to reduce the population. So I just think that sentencing reform is absolutely the way to go. We've changed some of the issues around parole violation. That's a good step. But in order to really make a difference, we have to look at the sentences that people are getting, and we have to look at the parole situation in terms of our lifers and the people who are just not able to get out. We have to look at, I'm sorry, I just said that. We have to look at geriatric parole. I think it's critical. I'm not talking about letting a few more people out on compassionate release as they enter the end stages of their lives, which I think is important, and the compassionate release bill that we already have that is law is severely underutilized. But we also have to look at every single prisoner who's over the age of 55, and let's make some rational decisions about who really doesn't need to be there and who can really get out now. I would also suggest that we look at a Prop 36 type of legislation for parents, so that people who are sole caregivers of young children can go into a treatment program that is not connected to the California Department of Corrections, where they can draw down some federal dollars, where we can stop putting looking at all of this as punishment, rather than really looking at, how are we going to change this situation? How are we going to make this state someplace that we can all feel proud to live in? The question of family foundations and the mother-infant programs has come up, and I've visited all of them, and I think they have some strengths. They definitely have some strengths. They also have some weaknesses. The main problem, though, is I don't think the California Department of Corrections really should be in the child-rearing business. At every one of those programs, what I've seen is that the children are kind of the afterthought, that no one really is following them, is able to tell exactly what's happening with them. We have asked it every time we go in, we ask how many children they have in these programs, and the only person who has ever been able to answer that question has been one of the secretaries. The CDCR people don't know how many children they have in there. The program people don't. I mean, obviously they could count them. They count them every day, but it's not. The children are not really in the center of those mother-infant programs. And I think that getting those children out of prison as well as their mothers is really going to be the solution. I think we have to end discrimination against people with felony convictions. As long as that happens, people coming out of prison are at a severe disadvantage when it comes to jobs, housing, education. They're having trouble reuniting with their children. It's a huge amount of discrimination that comes to people when they get out of prison, and frankly, it becomes racially based, given who is in prison and who comes out. So this is a time when our state is just in a huge crisis. We all know that, and we can face that crisis by fighting to save what little crumbs we have, or we can use it actually as an opportunity to look at real problems that face our state and look for real solutions, not stopgap measures. If we do this, we can look at our children and grandchildren and tell them that we stepped up, that we use this period of time to make bold changes that put the interests of all California's people ahead of those special interest groups that are determined to maintain the status quo. Thank you.
Thank you very much. Let's see. I don't know. It's a hard question about, because every time the answer is more money,
Yeah.
kind of thing. And you gave us a list of possible, really changes behavior for the institutions to try to problem solve, as opposed to following rules and regs that have been developed over a long period of time, and everybody has a vested interest in maintaining the status quo. But how do we assist these incarcerated individuals really without the need for additional funds? I mean, is it just simply a transfer of a different way of looking at prisons?
I think it is a different way of looking at prisons. I think the problem is, frankly, it's a lot cheaper to serve people when they're outside of prisons than it is to serve them, to provide whatever programs you're going to provide them when they're in. And that's why sentencing reform, by keeping people out of prisons, I think is really the key to it. We can't, what's expensive is to be building more and more prisons to incarcerate more and more people. And we've been doing that, and it hasn't worked. I mean, that's the problem, is that when my daughter was in kindergarten, which was a long time ago, there was already plans for how many prisons they were going to need to house her and her other kindergarten children. When the planning is in generations ahead, and it's all about incarceration and it's not about prevention, I think we have a problem. I do think that we have to, we really have to change our view of what public safety is about. And that public safety really can't be locking up every single person who does something that makes us angry. And that's sort of what, it's like an industry. It's something that everybody is kind of going along with. And I think we have to have the guts to say this isn't working and that we really need to come up with something else.
Dr. Owens?
To support one of Karen's points, last year, 2 years ago, I conducted a recidivism study in 15 states, and we found the two groups Karen identified, the women with the longer sentences in homicide, other murder types groups, had the lowest recidivism of any class of offender. Female offenders in these groups, in the long-termer categories Karen described, across the board historically have almost zero recidivism rates. Secondly, age. Age is inversely related with recidivism. So I think looking at these two possibly small but important classes of folks, women who've had their parole approved and have not been let out by the governor is one category, and women in these medical groups. It costs hundreds of thousands of dollars to maintain these women in custody. And I think those are two things through policy we can address. The numbers aren't huge, but I think the justice has a big payoff, and the data does support that. Thank you.
Thank you. I mean, there is a study that's going to be coming out talking about the troubledness measures. How women are different criminals as opposed to men. And we talked about, if somebody is convicted of a murder, a crime of passion, they're murdering somebody that probably has abused them, et cetera, and it's always kind of a one-shot deal. It's not a continual seeking out others that would perhaps perpetrate the same issues. But anyways, troublesome measures are something that the CDRC is implementing. But let's give Renee Hansen an opportunity to speak. She's the Assistant Secretary for CDCR legislation, and give us some background on female offenders and in the CDCR, and discuss some key legislative reforms.
Thank you, Madam Chair. I wanted to sort of set the stage for how we got to where we are with
That's great.
female offender reform, and Senator Liu's been there along the way. We really jump-started this initiative on female offender reform with the Little Hoover report in December of 2004, which was a real eye-opener, I think, to lawmakers and the department and the administration. Immediately, the department partnered with the Little Hoover Commission and Barbara Owen, Barbara Bloom, many stakeholders to develop the Gender Responsive Strategies Commission. And we actually, from there, started on the master plan before we were told to do the master plan. The legislature took notice immediately. The Women's Caucus was, it was probably the biggest push behind legislation was the Women's Caucus. A variety of important legislation was introduced. Then Assemblymember Liu introduced AB 658, which would have authorized alternative incarceration options for nonviolent offenders. It was held in the legislature. However, AB 478 by Assemblymember Lieber got us to where we are today with pregnant and parenting offenders and reforms that we've made in that area. AB 550 was the Goldberg bill, which made California the first state to implement a state-level PREA policy with the Sexual Abuse in Detention Elimination Act, the SEDEA, that we call it in corrections. Also in March of that same year, the Women's Caucus toured Valley State Prison for Women. Included in the caucus was Senator Speer, Senator Margette, then Assemblymember Liu, and Lieber. And a few of the caucus stayed the night to see what it was really like to house an offender in a California institution. I stayed the night as well. Senator Liu stayed, as well as Senator Speer and many staffers. Included in that entourage was Wendy Still, who was the first associate director over the Female Offender Program and Program Services mission of the newly developed FOPS mission in California Department of Corrections. In 2006, Senator Liu introduced a measure that would have codified the Gender Responsive Strategies Commission. And then AB 2066 was introduced by Assemblymember Lieber that was the precursor to AB 76, which actually outlined the master plan, which is our blueprint that we work from today. That was actually passed in 2007. So, the master plan. What have we accomplished thus far? A lot, actually. If you think about the fact that we embarked on this just 4 short years ago, in late 2004, early 2005, we've done a lot. We've come a long way with excellent partnerships from the California legislature. So, we created the Female Offender Master Plan. We contracted with nationally recognized gender responsive experts. We developed programs and training for department staff in female gender-specific strategies. We conducted a staffing analysis of all the current job classifications in our female prisons. We created a gender-responsive female classification system. We created a needs-based case and risk management tool designed specifically for female offenders. Of course, we partnered with the Barbaras, as they're known in our circles, and many other stakeholders on these initiatives. The Gender Responsive Strategies Commission, which I've been a member of since its inception, has had a variety of stakeholders involved: legislators, staff, offenders, providers. It's an excellent tool that still exists today, and so that's sort of our blueprint. That's sort of the master plan. That's sort of where we've come from. And Terry McDonald, the Chief Deputy Secretary for Adult Institutions, is here to really talk about where we're at today.
Okay, all right. That's good segue. So your position is that we've been implementing the master plan?
Yes.
Yes. Well, all right.
Absolutely.
Okay. Terry, we'll give you an opportunity to continue this conversation. You're Chief Deputy Secretary of CDCR, Adult Operations, and you cover the plans for the female reform efforts.
Yes,
You're responsible for them. So, please.
Thank you, Senator Liu, for inviting us today. I'm pleased to represent my Associate Director, Deborah Herndon, who's behind in the audience, and our wardens from the 3 female facilities came up today to demonstrate their commitment to female reform and rehabilitation as the FOPS division. And I'm also glad to sit in partnership with many people that have helped us along the way. Really, gender responsiveness, the concept of it came around in the early 2000s, where we began to see a national movement towards female reform that California hadn't yet implemented. And as folks, learned folks before me represented, they came to the table and said, listen, there's a different way to manage female offenders. And leadership from the legislature and leadership from academics and nonprofits stepped forward and said, here's what you need to do. We had a powerful force in Wendy Still to begin to change the way that we think about managing female offenders, and followed with commitment and resolve of our wardens and our staff in the prisons. We've done gender-responsive training in our facilities, and we're about 90% done with that. And Deborah Herndon's reached over to DJJ, Juvenile Justice, and asked them to join us, asked Elizabeth Siggins and her team to join us, and because I also supervise parole, I asked parole to join in that agenda. We opened a couple of, probably 3 new programs, and we haven't gone as far as everybody had hoped we'd go, and that's a fiscal issue, but it doesn't mean that we didn't commit to do it. We opened a 75-bed facility in Bakersfield for non-serious, non-violent offenders, and it's been largely successful. We just opened it in April, and hopefully we can get down there and show it to you. We opened the 25-bed female residential multi-service center, the Bridges program here in Sacramento. We've had 2 graduations in that. It's a very powerful program for managing female parolees. And I'll tell you, I was very proud when we went to the first graduation. The parole staff that got their offenders in there showed up for that graduation. So people are very proud of that program. We had originally done a grant to Los Angeles County to do the Women's Second Chance Act, which is a sentencing program by Judge Tynan, where female offenders, felons, are slated to go back into prison. Their parolees slated to go back in. Rather than going into prison, Judge Tynan sentenced them to prototypes in Pomona, where they do their time there and are managed by the courts. We took some of the FOPS money that we were going to utilize for the residential multi-service centers and funded that when the grant ended. I'm very proud of that program. The interesting part of that program is in our family foundation programs and our mother-infant programs, they're really non-serious, non-violent kind of offenders. The L.A. Women's Reentry Court are not non-serious, non-violent. Their current can't be serious and violent, but their priors can be. Mm-hmm. The other thing about that program is the women can be a sicker population physically. They're HIV inmates. There was a woman, we went down to court, Andy probably shared with you, she had lung cancer, had a lung removed. Those are not the kind of offenders that we currently are able to put in the FFP program and the CPMP program. So those are some of the reforms that we've done. The institutions did the Warden's Advisory Groups, where you mention things where we get kind of stuck in our regulations, and the regulations are male-focused. I think they've done an incredible job of saying, you know, these don't make any sense here. And so whether it's property, good example, you know, the bars of soap we use for men, women don't use those kind of bars of soap, or we limit how much shampoo we can give. They just don't make any sense. I think they've been largely successful in challenging the process of how we do business. The women's classification study, we're expecting the results of that in early 2010. We're very excited about what we're going to learn from that. Dr. Van Voorhees did a presentation for us at the Gender Responsive Commission early this year, and she gave us a preview which has helped to frame our thoughts about community-based beds. Dr. Owen had mentioned Leo Chesney. We're proud of Leo Chesney. It's trauma-informed wraparound services, and the substance abuse programming is gender responsive. We like that model so much that we're going to go out with an IFB, and I spoke to you about this in your office, an IFB for similar beds in the community. That allows us to put a little bit more serious offender than we currently have in the Bakersfield facility. It also allows us to begin to pull women out of the larger prison environment earlier in their sentence to begin to do programming for them. We would use, with permission with the Legislature and Finance, use some of the funding that we received for the FRCCCs to fund that. The challenge to that will be dental. You know, we have to be able to clear their dental issues prior to placing them, and I think that Ms. Herndon's been very successful working with our dental department to get women cleared to fill the other kind of beds. You had asked in the request how the impacts of summary parole were going to be on population. we're estimating that approximately 1,000 less female offenders will be in our system about a year after we implement the reforms. So that on the natural is going to reduce overcrowding. On the natural, it's going to reduce the impact to the reception centers so we can process women hopefully faster and get them out. Another innovation that's going on that doesn't really cost us any money was from the NIC study. One of the recommendations was to look at how we do business in our 2 Central Valley facilities and see whether or not it makes sense to specialize. So, for example, should we move all reception center processing to Valley State Prison for women and move maybe segregation or EOP or mental health treatment to CCWF? So those are the kind of things that are going on. They're not costly. I will also say that this is an opportunity like no other for us to really challenge working with communities to help provide services. Elizabeth and I have had Ms. Siggins and I have had the opportunity to meet together with people asking for support, with Mr. K2, California Endowment, for example. Elizabeth's been talking to folks. I'm sure she'll talk about, and I expect the wardens, Ms. Herndon, to start reaching out to the community, to local colleges, to talk about how can we do parenting classes, how can we do anger management, how can we do substance abuse. Those are the type of things that we'll move forward on. I'm available for any questions, Senator.
Thank you. I appreciate your comments. Let's go on with Elizabeth Siggins, the Chief Deputy Secretary of CDCR Adult Programs, to talk about the implementation and effectiveness of those programs and data collection that we've been talking about.
Sure. Good morning, Senator. I apologize. Winter's catching up with me a little bit,
Yes.
and I'm losing my voice a bit. What I was asked to brief you on this morning is how we've been implementing some of the cuts to our programs and the data that we've been looking at to make those decisions. I've been largely responsible for working with my team, Terry's team, and others to try and come up with those plans. I apologize. As you know, we have a $250 million cut in rehabilitative programs to the department's budget. To put that into some context, our budget in adult programs prior to the cuts was about $560 million. So clearly a cut of about $250 million is a significant decrease. We have been working aggressively to try to come up with models to change how we do business to mitigate the impact of some of these cuts. I'm not going to go into terrible detail this morning in this hearing over the changes in those models, but I'm certainly happy to answer any questions that you may have. There's another hearing this afternoon in the Assembly where we will be focusing in more detail on that. But I was going to try and focus more specifically on the impact to female offenders. Once we came up with the preliminary plans and these new models of what we could save in adult programs, the reality is that we went back to Cabinet and said that we really couldn't save more than $200 million in a full year and still remain committed to the Department's commitment with respect to implementing evidence-based programs, to trying to maintain our efforts to reduce recidivism, and so forth. And we turned to some of our other partners. Because not only were we, in the long term, did we not feel that we could go deeper than that, we also had an implementation time frame issue, and that is that anytime you try to make savings, the time that it takes to get that going, whether it's terminating contracts or implementing reductions in staff, there's a time frame. So our savings for the current year will actually be about $100 million. So we had to turn to the Female Offender Program Services and the Division of Adult Program Operations, where we also have some significant program dollars, to try to meet our goal for $250 million this year. So we are taking some significant reductions in both of those areas, but they are almost by and large, the vast majority of those are delays in programming that we would have been bringing up, not a reduction to existing services. And Ms. McDonald spoke somewhat to that. With respect to the $200 million, which is by and large a cut to existing programs. The breakdown of that $200 million essentially ended up being a cut to educational services of about 30%. This is across the board, both males and females, the initial numbers I'm giving you. A cut in substance abuse services by about 40%, with the in-prison programs being cut more significantly, about 60%, and the aftercare component by about 35%. And I can talk a little bit more about that, but that has to do with the research, which really shows that it's the completion of both components, the in-prison and most importantly, the aftercare piece, that really shows the reductions in recidivism. And so based on feedback that we received from the providers, researchers, and others, we were trying to disproportionately, or at least to the extent that we could, mitigate the impact to the aftercare component. It's a reduction of about 40% to our assessments, training, fidelity units. We were very committed to trying to maintain the infrastructure to do that, but found some other ways to do it that were more cost-effective and able to take some savings there. And then a 70% reduction to our headquarters adult programs components. We were very committed at the direction of the Secretary to make sure that we did not disproportionately impact the field. Again, as I mentioned, we've been working hard to come up with new models to try to mitigate the impact of these cuts. In education, we will be looking at ways to combine classroom instruction with independent study to be able to maximize the number of offenders that we can meet. In vocational programs, we will be focusing on programs that provide a certificate within a trade that the EDD projections show is a growing industry that pays a livable wage. A program that can be completed within 12 months, et cetera. And then within substance abuse programming, one of the things that we've been able to do is shorten that in-prison component. Previously, we had offenders staying in that program anywhere from 6 months to 36 months. By shortening that to a 90-day program, which again came out of a consultation that we had with a variety of stakeholders, we're able to minimize the impact to the aftercare. Still significant reductions, 35%, but minimize that impact and be able to increase the capacity, or at least maximize the capacity that we have available for in-prison. Still obviously significant cuts. Specifically with respect to the impact on female offenders. The reductions are most clearly shown in the area of academic programming. There we will see a reduction in capacity by almost 60%, and a reduction in vocational programming by almost 50%. And some of that decision-making comes from a decision that the department made actually based on criteria that we got in the Budget Act from the legislature, where we were directed to follow a certain principles in implementing this. And one of those, that we would target our remaining services to moderate and high-risk offenders. And as has been discussed here, female offenders are disproportionately low risk. And so as we look to allocate resources for the moderate and high-risk offenders, it ends up having a disproportionate effect on the female offenders. I know that there's been some concern about the instrument that we use to measure risk, and I'm not going to go into that now, but I'm more than happy to discuss in more detail the conversations that I've had with the researchers based on those concerns. One of the things that I had numerous conversations back and forth with Ms. McDonald as we started looking at these cuts and trying to figure out what we could do to try to make some gendered responsive decisions where we could, and still stay true to some of these principles. And one of the things we looked at was that the average length of the female offender is significantly shorter than the male offender, and the academic and vocational programs tend to be longer. The average length of female offender, time served by a female offender, is 13 months. And those academic and vocational programs are longer, but our substance abuse programs, particularly now that we're reducing them in length, we realized that that was an area where we could disproportionately serve female offenders. And so there, we're actually only reducing the substance abuse capacity by 12%, which is far less than how we're reducing it in the male institutions. And I think that was, one of our ways of trying to be able to counterbalance the impact on the female offenders. I have some other details here that I think I will wait and see if the one of the things I think that is worth trying to put these into some kind of a context. And this isn't meant to defend the program cuts, but hopefully to help explain them. One of the things that we tried to look at is how well will we serve the eligible capacity based on these cuts, and it helped to give us some comparison. What we will be able to do within substance abuse is actually serve 22% of the eligible females, and that's much greater than the capacity for the males that we're going to be able to serve. That would be 5%. And in that regard, we're actually talking about eligibility based on a very traditional form of eligibility, that someone's not in a mental health bed, a crisis bed, those kinds of things. Our target population, of course, is going to be much narrower as we look at moderate to high-risk offenders within some time to release. With vocational programming, we really will, unfortunately, only be serving both males and females around 4% of the population, so a very small percent will actually be meeting. In terms of the eligible capacity, again, in terms of the target population, it'll be somewhat higher. And then academically, as I mentioned at the very beginning, that's where we'll see sort of the most disproportionate impact to the females, where we're really, if you look at our just very traditional definitions of eligible population, be serving about 22% of the females compared to about 36% of the males. If we look at the literacy mandates, we'll actually, not specifically I'm talking about the Sterling bill, which requires us to have programming focusing on literacy, we'll actually be a little bit closer, in fact, pretty close to meeting those mandates in terms of having programming available for 60% of the population that reads under a ninth grade level. And that is in part because the females tend to have about 45% of the females are under 9.0 reading level compared to over 50% of the males. So again, I say all of that to help you understand how we made some of these very difficult decisions and to understand what the impact will be on the female offenders. We've talked a little bit about some of the things that we've tried to do to offset this. When we established our vocational criteria, cosmetology would have been one of the programs that actually would have been eliminated, and we made an exception there to retain cosmetology out of an understanding that it was a gender-responsive program and an opportunity for us to maintain that. At the institutions where that position was vacant, we also had a commitment to eliminating vacancies first to try to mitigate the layoffs. So we do have at least one instance where we had a vacant position, so we did eliminate the cosmetology program because the position was vacant. We have been having numerous conversations with Chaffey College and are going to be able to retain that college program at CIW, which I'm very happy to report, and that really is because of the incredible commitment that Chaffey College and the work that they've done. We have been recently establishing life or mentor training programs where we're actually training long-term offenders to be certified substance abuse counselors. We did this last year at Solano with the male offenders, and we've built into our new models a program that we're going to be implementing at Valley State so we can train the long-term female offenders to be actual substance abuse counselors. As was mentioned before, we've retained the Leo Chesney program, a very important trauma-informed substance abuse program for females. We've maintained the FOTEP programs, the female offender treatment and employment programs, at their previous levels. We had been funded to expand them. We will not be able to proceed with the expansion, but we will maintain them at the levels that we had before. And as been mentioned before, we've implemented a gender-responsive compass. We're maintaining the SB 618 program at CIW. And the case management services at the Visitor Center. Obviously, incredibly difficult decisions and some very tough impacts on the female offenders. And as a department, we remain committed to finding alternative ways that we can problem solve in this area and stay committed to our gender-responsive strategies. Thank you.
Thank you very much. So we've had 3 folks from our CDCR talk to all of us about who gets affected, what kinds of programs are going on, and consequences of program cuts. Any comment from the academician and the nonprofit person who would like to respond to what's going on here? Dr. Owen.
Thank you, Senator. I have a couple of comments. One is I appreciate the updates on the status of the different things, both required in the legislation as well as in the master plan. But I would like to hear more about the recommendations from the staffing analysis. CDCR partnered with the National Institute of Corrections and used some national experts. And one aspect of the staffing analysis was referred to, but I'd like to hear more about that. In discussing about the different programs, I just want to repeat that program fidelity is critical. If the program is not implemented as designed, if the program is not monitored, and I'm all for using peer counselors. I'm a big fan. There's a lot of evidence that peer education is very successful. But however, there are some issues with peers having control or power, other peers that must be addressed. One of these days I'm going to finish my book on the New Choice program. I spent 16 months watching one of your SAPs, and so I understand well the dynamics of having inmates in charge of other inmates. I want you to caution you about monitoring that very carefully. This is kind of an esoteric thing that probably drives people crazy, but so many of the recommendations CDCR has followed have come from the evidence-based practice literature, which is entirely a male-based, male-normed literature, particularly the risk principle. It defines risk in a very male way. The National Institute of Corrections has supported the evidence-based practice approach, but they caution it agencies very carefully not to apply that to women. There's recent literature that is not in the CDCR thinking about how evidence-based practice does not apply to women. Work at Dana Hubbard and many other people. So this idea of risk focusing on the last, right before they're released, really doesn't apply to women. And so I really caution you to adopt that. The work of Pat Van Voris and the classification and Northport and the Compass come together in one point, and that's a case management system in the institution, and I haven't heard anything about how the case management system is being designed. That's also underscored in the staffing analysis. Two recommendations that Barbara and I made in our last final report when our contract ended was increasing the ombudsman services. Out of all the programs CDCR has, that to me that's one of the most effective in making sure individual voices are heard, addressing problems before they get too big. Again, I know the office has had cut, but I think that's a penny-wise, pound-foolish effort. In the same vein, the Friends Outside services. Karen mentioned parenting, anger management. Friends Outside is the provider of most of those things, and I urge the department to look closely at those and making the exceptions. Again, program fidelity. It's one thing to have a program, but it's another thing to follow it. And I think you ask about research. To me, that's where the most important research is. And finally, I just want to repeat that programming increases safety in the facilities. I do a lot of PREA training around the country, looking at, you probably know, the Prison Rape Elimination Act, and in our own empirical work, as well as some of my operational work on PREA and many other studies, we find that increased programming is increased safety. Safety and risk are different concepts when it comes to women, and we define safety from the male lens. We lose fact of some of the dangers women are being exposed to. I will commend CDCR for their staff sexual misconduct training. In all our interviews, and we did lots of interviews, as the wardens can attest, in the last year, women reported that staff sexual misconduct is very low, but they also report that verbal harassment is very, very high. And I'll work with Ms. Herndon and her staff to think about ways in which verbal harassment can be treated the same way as staff sexual misconduct. But you should be commended. The women report that outright sexual misconduct is down, but verbal harassment is up. And I have to say, these program cuts have go a long way in eroding women's safety. Thank you for listening to me.
That's great. Thank you. Karen, do you have?
Well, you know, I think that some of what Barbara said makes sense, and I mean, I listen to these numbers and I find myself getting really lost in them. To me, I think that the proof really is in the pudding, and what I would urge is to go down to the prisons and ask them now how things are going, ask the women themselves how things are going now and how they're going to go in a year when these cuts are really in place. And one of the things that troubles me and this is not necessarily only for the women's prisons, it's true across the board that I've heard this sort of analysis, well, we can get volunteers, we can train people in the community to to take up the slack in certain places. And I think that that's true if you're talking about San Quentin, when you have a urban population surrounding it with people that are very concerned about people in prison. Very concerned, not necessarily so much in the women's prisons, although I think it's an issue, but I look at Chuckawalla State Prison out in Blythe, and I wonder how you're going to get volunteers to fill the gap in any kind of meaningful way. And I think that, I commend you. I think you guys are doing a really hard job, and you're trying to figure it out. It's not about will. It's about, sort of where is this money really going to be spent? And it seems to me that, you take out of this pot and put it in that pot, and you're not really affecting the overall problem.
Thank you. Ms. McDonald, do you want to respond?
I'll take it. Thank you so much. Dr. Bloom, maybe I can, or Owens, I'm sorry, maybe I can talk a little bit about the NIC study. The Barbaras. I know. They confuse Elizabeth and I, too. The NIC study, maybe I can give an overview of what we are working on currently, or have already worked on, and kind of what we've put on the back burner because of the fiscal issues.
You mean the staffing analysis?
Yes. Yeah, the NIC study. So one of the recommendations was to accelerate technology solutions. I think that the SOMS solution that's right around the corner meets that time frame. Also, the Compass Risk and Needs Assessment tool are a couple of technology solutions that are there. Reduce capacity between the summary parole, the credit earning, and the IFB that we have out for CCF beds. I think will meet that end, not wholly. We also have a response to the 3-judge panel with other solutions, so that we're working on that one. They asked for a FOPS coordinator at each institution to address fragmentation of gender-responsive programs. Frankly, my opinion is that the warden's responsible to be the FOPS coordinator, and the entire management team is responsible to make sure that we're being gender-responsive. Conduct a feasibility study to consolidate functions, and I mentioned that. I expect that report from Ms. Herndon early in 2010, and we're going to implement where we can. Update post orders as gender responsive procedures are implemented. That's normal procedure, and post orders are updated annually. And then we should use an Excel model to determine additional program and staffing needs. I think that Ms. Siggins has good tools available to her to run data runs on the type of offenders we have and the type of programs we have. So I think we have those systems in place. Some of the more, and also to evaluate the feasibility of extended program hours, but with the cuts, it's probably not teacher vocation, but it may be ILTAG kind of programs, AANA, things like that. There was a request to place a FOPS representative at 3 prisons. That's a fiscal issue. I don't see us being able to do that right now. To research the case management model. And we do have some procedures that Elizabeth's team and my team have been working on. Frankly, implementing the case management plan as written is probably a resource issue as well. So we're finalizing those regulations, and from there we'll have to figure out the resource implications of that. Dr. Owen, was there anything else that you wanted me to cover on that?
No, the most important aspect to me of the staffing analysis is the case management model. It's one thing to have the world's greatest classification system, the world's greatest sorting system through the North Point Compass, but without the services and the case managers, you might as well not do it. And I think that's part of the problem of all large organizations is half-stepping things. And again, I'm just going to repeat, program fidelity. Volunteers, inmates, without having the staff, you're not going to have the comprehensive fidelity that programs need. And so doing half-stepping is almost worse than doing nothing in some ways.
Can we do this with cuts?
The argument, as I understand it, in the NIC staffing analysis, which I haven't seen the final report, but I was a consultant at the beginning, is to think about switching some custody positions into case management positions. And we know the struggles to do that. My partners at CDCR are well aware of the sanctity of custody positions, I might say. But I think that we need to think about case managers instead of more custody positions when we start thinking about really changing how women live in the facilities.
Okay. All right. Thank you very much. We have one last panelist, the person who always gives the worst figures about how we're going to proceed, the LAO's office. Mr. Edwards is new to the LAO's office, but he's in the fiscal policy analysis, and let's talk about the impact of programming cuts from your perspective.
Thank you, Madam Chair. Aaron Edwards, Legislative Analyst Office. Based on our preliminary analysis of the department's plan, that we believe that under the circumstances they made some very reasonable decisions overall. However, we have identified several areas that we think are worthy of legislative consideration. First, by way of background, I'll describe the cuts to CDCR's budget in a little bit more detail than has been previously discussed. The 2009-10 Budget Act includes substantial cuts to the corrections budget, especially in the area of rehabilitation programming. So the overall cut to the CDCR budget was about $1.2 billion. To put that in context, that's about 10% of the overall budget. By comparison, the rehabilitation programming budget was cut by $250 million, and that's roughly 30% of the total rehabilitation spending. As the department noted, the majority of those program cuts are going to come from three major program areas: substance abuse treatment, education, academic programs, as well as vocational training. And we do believe that there will be some disproportionate impacts by gender in these program areas. As Ms. Siggins noted, the department will reduce their capacity to serve women in academic programs. This includes GED courses, literacy training, as well as adult basic education. Their ability to deliver those programs to women will be reduced by about 60% as compared to this time last year. By comparison, the capacity to serve men will slightly increase. On the other hand, the department's capacity to provide women with substance abuse treatment will be reduced by 12%, and that's less than the overall cut to men's substance abuse treatment, which is about 35%. And for both men and women, the capacity just to be served in the vocational training programs will be reduced by about 50%. In addition to that, there are some major female parole and reentry program contracts that will be delayed, as well as some programs that will be eliminated entirely, and some programs that will be reduced. I'll go into a little bit more detail about each of those. The department had planned an expansion of 2,200 reentry beds for women that would have allowed women to serve out their sentences closer to the families and the communities where they're from, while receiving a broad array of rehabilitation services. Due to the cuts, they will no longer be able to proceed with that expansion. They will continue to maintain the 75 beds that are currently operational. Similarly, they will delay a planned expansion of 400 female residential multi-service center beds, as well as 150 female offender treatment and employment program beds. Both of these programs allow women who are on parole to receive a broad array of rehabilitation services in a residential setting. The department also plans to scale back their largest community-based drug treatment program for both men and women. They'll be reducing capacity from 11,600 to 3,200, and that will make it considerably more difficult for members of both genders to access treatment while they're on parole. In addition, the drug treatment furlough program will be completely eliminated. That's a program that allows offenders to serve out the last 4 months of their sentences in the community in a residential treatment setting. There were about 400 beds available, and as of last October, about 40% of those were occupied by women, and so those will no longer be available. And in addition to reducing the capacity, the department will make some substantial operational changes to the remaining academic and substance abuse programs in prison. The educational programs, the changes include a reduction in classroom time. Previously, they've been receiving about 30 hours of classroom instruction. Now it'll be between 3 and 15 hours a week. There will be an increase in the student-to-teacher ratio. Previously, it was about 27 to 1. It'll go up. It'll be between about 100 and 200 to 1 after the changes. And to offset the increase in the workload to the teachers, they will be utilizing teaching assistants and inmate tutors. Substance abuse treatment, the major change there is a shortening of duration from 6 to 36 months to 90 days. And Senator, you had asked earlier about suggestions for how to serve more people without increasing spending. One recommendation our office has issued in the past is that you could fund educational programs based on actual attendance rather than enrollment in those programs. And that would create incentives for the institutions to ensure that inmates actually get to the program, so you're actually serving those inmates. Historically, the attendance rates have been quite low, around 50%. And the department has made substantial progress in improving that. And we hope they'll continue to do that, but we think that is one recommendation that could increase the number of inmates who are actually being served without spending more money. And then finally, I'd just like to conclude by saying that we think data collection and evaluation is very important moving forward. We don't have as much data on how these programs are actually, how successful they are. For example, it would be nice to track recidivism over time for program completers. And we hope that someday when we're in a better budget situation and we're able to ramp these programs back up, that would allow the legislature and the department to understand which programs should be scaled up and brought back based on effectiveness. And that concludes my remarks. I'm happy to take any questions you have.
Thank you, Mr. Edwards. How can we, since women, the majority of which are in our system, are nonviolent offenders, is that correct?
I think about 60%.
60%.
Yes, ma'am.
That's the majority. And I know the legislature, and you're going to go to the assembly later on this afternoon. I sat on that committee when I was in the assembly, and I know that some of the first, I guess, abilities that when we look at the prison year budget, and we are able to kind of line item those services that to eliminate. And education has always, it's kind of counterintuitive because it's the easiest to strike out, and yes, it's the most needed for those who need the help. Please, let's just see if we can get through this in some kind of meaningful way. So it's counterintuitive to me that we take away rehabilitation. When we know that in order to make life whole is to get people back into the system, into society, whole, better than they were because they were told to go to prison. And yet, I don't quite understand why these programs are eliminated or cut back as opposed to just having people sit in their cells or whatever they're doing in prison, just walking around or whatever, not doing anything productive. So, and I don't know whether that gets anybody, because most people will come back out into our communities again. And they need training, they need education, and they need lots of services. I understand that the budget cuts, believe me, I'm not in the business. I didn't come to the legislature to make these horrendous cuts. And there's going to be more coming. But we as a group have to really sit down and try to problem solve this issue, because it's you can go through and talk about your programs and talk about which programs are going to get eliminated, but in the end, what are we doing? as a society for people who've made mistakes. So, it's not. So I'm very concerned, and we're not well regarded either at the legislature. But I'm really concerned that we try to do our best and rack our brains about how we best can deliver this under the confines of what people are willing to spend their money on. It upsets me that, because I used to chair higher ed in the assembly, that the higher ed budget is now the same as our corrections budget. And I'm dealing with 175,000 folks in corrections, and almost 175, at least 2.5 times more of those kids going to higher education in the state of California. And there are terrible choices here, because it's much more expensive, as far as I'm concerned, to rehabilitate somebody who's made a mistake than to make that investment early on for our young people. But here we are, and we need to rectify this somehow and to make better decisions about how we spend our limited resources. Dr. Rowan.
Senator, I mentioned, as did Karen, I think we all have to take a step back, and this is totally out of CDCR hands, and that is talking about sentencing reform. We always act like it's a given that these individuals who are convicted of felonies have to go to prison. And I'm old enough to remember the probation subsidy program. I'm old enough to remember where counties were given incentives to maintain convicted felons on probation. And in the last 15 years in this state, for a variety of reasons, everyone in this room probably knows, prison has become our act of first resort rather than last resort. And I think this budget crisis forces us to think about the political realities of sentencing reform. And again, for a lot of reasons, we tend to have more discussions about the prison rather than about the sentences. And I would just urge the senator to think more carefully about what true sentence reform would mean, not just for women, but for men too. But when we talk about women and we look at the kinds of things they're sent to prison for, there's reasons their average time served is 13 months. There's reasons that about 67, 63, however you cut it, % of the women are nonviolent non-offenders. So I too am a realist. I deal with the reality of there's men and women locked up in this system that we have to think about every day. But I urge the senator to begin the conversation about sentencing reform, because we will never get out of this devil's choice until we quit sending so many people to prison in the state. Thank you.
Thank you. Okay. Any others? Okay, we only have a few people who've signed up to do public comment, but the first one is Cindy Greer. Cindy?
Good afternoon. Thank you, Senator Liu. Thank you, panel members. Thank you.
Go this way. Is there a button on your, on the stand? A red button?
I don't.
With a microphone. Oh, it's on. It's on. It's okay. It's on.
I will start over. Thank you, Senator Liu. Good afternoon. My name is Cindy Greer, and I currently teach at Valley State Prison for women, and I have served my entire CDCR career there. I was there before we got the first inmates in 1995. Taught a variety of programs, Adult Basic Education 1, 2, pre-vocational program, and now I am doing an adult high school diploma program. I've helped over 50 women graduate. We have some folks with us today. We have a rather large audience, and they touch a lot of folks who we're going to be doing things differently with. So I'd like to just give you a quick idea. If your position is to be eliminated by January 31st, would you stand quickly, please? That's a lot of people who program these populations that we've been hearing about. Thank you. Thank you all for coming. At Valley State Prison for Women, since it's gender responsive, we currently work with a little over 50% of the population every month. We do that with 22 academic instructors, 13 bridging instructors, and 14 vocational programs. You've already heard about the tremendous cuts that are going to happen. With the proposed models that are being put forth, the department's going to claim that we're still educationally serving as many people. I find that ludicrous, and I know there's much more discussion to come about these models, but touching someone is not educating them. So we have a huge cut, and we're trying to make do, but we would like to certainly sit down and talk with anyone who will listen about some other ideas besides these proposed models. We heard this gentleman talk about attendance, and we always thought at the women's prisons that when these cuts came about, because it's been coming down the pike ever since I've worked for the department in '95, we've seen the budgets go up and the amount of money go down. We have seen and it's been told program, and we have. And at the women's institutions, our X time it's called, which is on hands with the inmates in class, our students, is very high. We came up with an innovative program at our school where instructors that were out in the field with the bridgers who go out into the housing units, they substitute one day a week so that we kept our programs open with talking about getting the programs to have fidelity and to have continuity and to get these numbers that we needed for our reports. We have a graduation every quarter, and we do touch a lot of lives. We have a lot of success stories. Unfortunately, this department has never really tracked, so we've had a hard time seeing how much that is, and that's a shame, and I'd like to see us go forth and try to get these numbers, especially with the female offenders. Because of the unforeseen economic savings that we don't see with high school completions and GEDs. Currently, the high school program is one of them that's slated to be stricken, and that's a shame because GEDs, yes, we can claim a number, but we don't get the intellectual transformation as what happens with an education process. The department has been famous for hiring consultants and experts over the years. Since the 90s, we've had dozens of them. There was a report out in 2007 by Joan Petersilia, and she talked about evidence-based programs. And in that report, they said that evidence-based is two parts. It's research and it's experience. And unfortunately, the proposed models have neither of those going forth in the female institution and the female population. To talk about me going from 27 students, which I have an entire school in a room, I teach every high school subject, I would be doing algebra about now, to be able to say that we're still going to teach them with 135 or 160 or 190 is absolutely out of the ballpark, does not compute. And to say that the assessment, the static risk assessment that's being done is not gender norm does need to be said. And it does need to be said that, yes, we don't have as many female offenders that are high risk, but we have 70% of them that are mothers that are providers. If we don't get them these programs and these diplomas and get them onto vocational training, the economic costs down the road are going to show that the recidivism rates are still there. They're still very high. We work at our WASC accredited school, which has been the highest WASC accreditation that you can get, which is Western Association of Schools and College. 6-year no review since I've been there, since its inception. And we do that by working with these women and working together. When I get one that passes the high school program, I give them to my friend who teaches the incarcerated youth offender program, which is now the IIP, the incarcerated individual program, which we receive federal funds for. They can't be in her program until they get a GED or diploma. They go there. They do that around while they're doing other programming, so I can also get them into vocational training. And it's just really disheartening that I haven't been able to hear a lot of success stories, but because that coordinator does get to be in touch with parole officers and things, there are former students I'm hearing about that through this continuity, through this stair-stepping, not half-stepping, but complete stepping, we are getting results and we are reducing recidivism. And so the model we're going to is just going to do away with life as I've known it as far as our WASC accredited education. There's a lot of ways to still streamline. Wendy Still's name's come up several times. She's an amazing person. I tried to work with her as we were doing this assessment to get these transcripts, because if we're going to do a holistic approach, we need to look at where their education was when they started, and we really haven't ever done that. So we need to start pulling those in at reception. What are their transcripts? What did they have, so that as we're setting up a program for them, that if we can get these services and everything together, that we're saying, okay, you only need that algebra class, you only need that economics class. Hey, through an independent study or whatever, we can pick that up no time. We can get you that, and we can finish that high school diploma. These are some minor things that make a huge difference that have never been instilled. Again, these proposed models are not evidence-based. We do have a bunch of dropouts, and I started to say high school dropouts in my note, but a lot of the women, as you found in your research, drop out sometimes before high school, and then at 9th grade again, and then again at 11th grade. And of course, the highest reason with the women is pregnancy. But in my research in the master's program I'm currently in, what I found fascinating is that in the incarcerated population, so many of them are learning disabled. They dropped out for a reason. They dropped out because of the fun that was made of them, because they couldn't read well or their grades weren't well, and so rather than deal with that, they dropped out. So we have 30 to 50% of them that are learning disabled. So to say that we're going to hire over 335 teaching assistants, and now I'm going to oversee teaching assistants and 190 inmates that are learning disabled, the remediation is not going to happen. I am an expert in what I do, and I am an educator, and you cannot remediate if you're trying to just oversee a large crew of inmate helpers and a teaching assistant with a high school education or a GED. I personally oversee every test that my students take right now for the integrity of my high school program to make sure they're earning this diploma. And every once in a while, in the years I've been doing this, a key will get out there, or the answers will come, and every once in a while I correct a test and it'll say, for the answer to the question, answer will vary. So I have to get right on that. If I'm overseeing so many and I can't actually run through and look at those tests, then I'm not able to catch that type, and I'm going to lose integrity. So then we become a number mill. And so, yes, we've got cuts. There are some other ways to do this. The AEDM has been on the board for a long time. There's some other ways to look at the distance learning. There's some other things without these totally selling everything down the river that we have started to see changes with. So I urge you to, Senator Liu, to be sure, and I'm available. My information's in the packet. I have a lot of years invested in this, and it is more than a job. When I see someone graduate, it just puts me on cloud nine, and it is. I know of one of my students that went through the IYO program that got a hold of Ms. Anderson and said, please tell Ms. Greer that I am now employed with the job that I couldn't have gotten without my diploma. And she's in the agricultural area out of Salinas, testing, doing lab samples of water to make sure we don't get E. coli and all of those things. So now she's not only back in the populations, but she's helping protect our health. So it's very gratifying. When we hear best practices, that's important. That's important, and I don't want to hear those words with the new models, because I've not been able to find out who came up with the models or any research or evidence based on them. So we'd like to look at maybe some different scheduling, the AEDM models. There's a lot of other things to do with the funds that are available. So we'd like to be able, before all these plans come down the pike, to be a part of that, because we are in the field and we are the part of the evidence base that is the experience, and we don't feel like sometimes we get hurt.
Appreciate that. Thank you. Please. Cynthia Chandler? Chandler, okay.
Thank you very much. So my name is Cynthia Chandler. I'm the executive director of an organization called Justice Now, which is a human rights organization providing legal representation to people in California's women's prisons. I'm also, as an attorney, I've helped or herald the field of compassionate release, and Justice Now helped sponsor one of the only recent decarceration legislations in California, which was aimed at and which successfully passed and now allows for the release of people who are permanently incapacitated as well as terminally ill. And so I'm familiar with the challenges that come with promoting even a piece of legislation aimed at releasing people who are brain dead from the Department of Corrections. And I understand the difficulties with that. Despite that, I'd like to encourage, in my testimony today, and I submitted a longer testimony, I'd like to encourage a real focus on reducing the population in prisons, an actual real commitment to that, and actually a removal of an adherence to the master plan that was proposed and a redirection towards focusing specifically on reduction of population. So basically, one of the things that Justice Now has been doing over the last 6 years is a long-term study of the destruction of the right to family of people in California's women's prisons. We've been conducting research in collaboration with people inside the prisons, documenting violations to the right to safe motherhood and problems around care, prenatal and postnatal care. We've also been documenting destruction of reproductive capacity and also the violation of the family that comes through premature death and dying in prison due to medical neglect. Some of the abuses that we've uncovered, I just summarized in my written testimony, but basically the crux of it comes to the fact that we've identified many different abuses which are not necessarily newly identified, which have come up through lots of litigation. One of the things that we have really tried to document is how these abuses are already illegal. There are already laws that are challenging them, and that they are incredibly pervasive to piecemeal reform. And it really highlights systemic problems with imprisonment that generally create abusive conditions. Now, as we take that information that we've gathered over the years and move it into our contemporary setting with radical budget cuts, we're seeing not only the devastation that's coming with the reduced programming and educational opportunities, we're also seeing a heightened sense of punitive culture within the prison system. So we're having folks report to us that toilet paper is being rationed and that guards are going through the housing units, searching cells and turning up people's cells looking for extra rolls of toilet paper. Now, I'd argue it probably costs more money to pay the correctional officer to search for the toilet paper than the few rolls of toilet paper. Similarly, there's been rationing of salt packets and searching out of salt. There seems to be a way in which the budget cuts are being used to justify a heightened level of harassment, brutality, and create basically a general level of suffering. Within that environment, we feel it's necessary to acknowledge the fact that the state is completely and utterly unable to maintain the prisons that they currently have existing. And the idea of doing any kind of expansion, even if gender-responsive expansion, is certainly not a good idea at this moment. Additionally, we're concerned with what will happen in these prisons as the programming is done in a piecemeal fashion without assurances of long-term commitment or ability to maintain those programs. And importantly, when these programs were first proposed and these new prisons were first proposed, the idea was that people would be closer to their families, that this would help families reunify. The programs that have been put together now either continue to locate people in the Central Valley as far away from their families that they did before, or they're significantly farther. It's important to recognize that about 80% of people in women's prisons in California come from Los Angeles and the surrounding counties. We're not seeing folks relocated back down to LA. So this will leave people farther away from family and resources with less accountability in terms of oversight by family, what's going on there, without a real long-term commitment to the conditions within them. So basically, what we'd like to argue for is a real shift, a shift of thinking that instead of gender-responsive prison expansion, what we really need is a level of gender justice, or a level of justice for all people, frankly. And what we'd like to argue that we need is we really need to have the legislature, and I would implore on you that we need the legislators' commitment and resiliency and strength around the idea of population reduction. And one of the contexts that we're in is not just the financial context, but also the federal population control lawsuits, which is a real present condition that is the context of all of what we're talking about. There are some basic ways that population reduction can happen that might involve not imprisoning people on technical parole violations, other things that wouldn't be about mass release of people, but would be ways that we can start reducing the numbers of people who find themselves in prison to begin with and save enormous amounts of money. Additionally, I think it's true that we do need to, with those proposals, have linked in specifically proposals to support communities and not prisons, so ways in which we can reinvest some of the monies back into communities. And by that, I specifically do not mean, I don't want community services to be commingled with the idea of community prisons. I really mean reinvesting in municipalities and what's happening on the local level to support people. 3 weeks ago, I accompanied a person on her travel home from the Central California Women's Facility to East LA and helped her for about a week while she paroled. There are now so many people paroling to East LA, and there's this threat of no money to provide services, that they sent everyone from this woman, my friend's area, up to report to Pasadena. So I had to take her all the way up to Pasadena without public. I mean, I had a rental car. She didn't have anything. There's no travel vouchers. There's no anything for people on the local level. There's no food stamps if you have a drug conviction, which many people in women's prisons do. There's nothing. So luckily, I had a rental car, so I drove her, and it took an hour by car without traffic to get to this reporting location. It was sort of like automatically setting people up for another term of commitment. When we got there to this parole orientation mandatory meeting, the services that were being provided in that area were virtually non-existent, and what was there was faith-based, very Christian-based programming, which is good for some people and very alienating to others. And there was a real limited amount of basic things, like everyone had their hands up asking how they could get food, how they could get basic housing, how they could get a travel pass so they could get back to LA from where they had come to travel all the way up to Pasadena. What we really have to look at is that our local communities are suffering as well. And it's about time, I think, and one of the things that might come out of this crisis is that we start reinvesting in communities and make sure that people can provide education and provide services there rather than using our prison system as an outreach provider. So anyway, I would just implore upon the committee to take very seriously a commitment to reducing the numbers of people who are in prison in the first place, and a commitment to finding ways to help fund community efforts that are not correctionally controlled. Thank you.
Thank you. Sharon Snarhill? Sharon?
Go ahead and go to Michelle.
Okay, we'll go to Michelle Green. Elijah Mohammed?
Hi.
Hi.
My name is Aliyah Muhammad.
Aliyah, I'm sorry.
And I'm a member and co-founder of All of Us or None. All of Us or None is an organization that is made up of formerly incarcerated people, and we fight the discrimination we face once we get out of prison. I wanted just to say that as far as education in CDCR, I don't think any of the programs should be cut, especially the women who take, program in the courses there. When they get their certificate or whatever, they are it really builds their self-esteem. It's probably the first time they've ever received a certificate of any kind. And it's really helpful. It helps them to go on and think that they can do something different with their life and, move forward. I really wanted to say that our organization would like to work, because we're the experts as far as our lives. We're the experts. And whatever decisions are going to be made about us, we should be involved too. And I just would like you to consider All of Us or None to talk to and to work with.
Thank you.
That's all.
Thank you. Thank you for coming. As Michelle Green or Sharon Snarhill?
Good afternoon, Senator. My name is Michelle Green, and I'm an alumni from Fresno First Mental Health Services, VOTEP Region 1. And I just came to speak about how the services really affect people, what they do for people. I got out of prison. I went to Fresno First. I only had to be there for 4 months. I decided to stay for 16 months. The services were so great there. They've turned my life around so much. Not only did it rehabilitate me, it rehabilitated my family, my 6 children. On the day I started college with my son, my daughter, and 2 of my daughter-in-laws. By the grace of what the program did for me, it opened up my children's eyes, which were going on the wrong path. When I was incarcerated, my sister was taking care of them on welfare, putting more money out from the system, you know, and by me being rehabilitated and these services that were offered to me, it really rehabilitated my family, and services were offered to my children. So by the money that's put out to rehabilitate one person, it affects so many other people. And I just read on the internet yesterday that a ratio of the people that are rehabilitated, 35% turn around and go back within 2 years. The people that aren't rehabilitated that go back within 2 years is 54%. That's a 20% difference of the cost for people to be rehabilitated, but you're not rehabilitating just one person. It's affecting a whole family, and so much good is done for it. I'm in college to be a drug and alcohol counselor. My mission is to go back into prison and recruit women and let them know there's a chance for them and their children for a better life. I just can't see these things being taken away and it not be given. I'm 42 years old, and I was one of them people that made mistakes for 25 years. I never had a job, filed taxes, or anything. And by the services that are out there right now, it has changed my life tremendously. And if this is cut, it's just going to make things so much worse. They save money now, but then there's more money that has to be sent to house people, to build prisons, and so on and so on. And it is just by so much, you know, people that work with it on a daily basis, you might see it. But for people like us, you don't know the outcome and how much it helps us. What's good for one is not always good for others. But there is so much good, and I've seen so many people progress from these programs. I'm very involved in my program. That's why I'm here today. And I just can't express to you guys how much need there is for these services. Thank you.
Thank you very much. Thank you for your story. Sharon? Sharon? Yes. Okay.
Hi. My name is Sharon Snarehill, and I wanted to come out today to talk about in 1992 being a person who made a mistake in an in-prison, and I got the opportunity to go to an in-prison SAP program, and some of the experiences that I had in 1992 versus what I experience with the women today in 2009. In 1992, when I was at CIW, I got the opportunity to enter in-prison SAP program and go out into a community-based program. But while I was in the institution, some of the things that I saw, the way that women were treated, verbally, some of the misconduct that happened in the institution, having to make a choice about whether I needed to go to get substance abuse treatment or GED at that time were some of the choices that I faced in the institution in 1992. Since that time, I got the opportunity to go to a community-based treatment program where we received substance abuse educating, 12-step meetings. We had no assistance with job readiness. I didn't receive assistance with getting my child out of the system. And I also didn't have any way of actually knowing how to be a parent. There was no parenting classes or anything at that program at that time. And also I didn't receive assistance with transitioning into the community. Over the last 10 years, I've had the opportunity to be a part of a program called the Female Offender Treatment and Employment Program. And what I know about this program firsthand is that the women receive way more than what I received in 1992, and I'm very grateful to be a part of it. They no longer have to make a decision in the institution whether they want to get GED or in-prison substance abuse treatment education, because they get the opportunity to do both if they need to. And I also just want to say, I just know that it's so important that a woman receives her education. It boosts our self-esteem so big, and then to receive the substance abuse treatment just makes us a much more whole woman. One of the things I know that at the FOTEP programs, the Female Offender Treatment and Employment Program, is that the stay is much longer. They get to stay into the program up to 15 months. And as a woman, some of the barriers that we have are, as I didn't receive help with receiving my child out the system, today I get to assist the women with getting their children out of the system. So the programs today come with vocational developers who help them with job readiness. It comes with the child care at the facility, which helps them. They have a safe place that they can leave their children while they're receiving substance abuse treatment and educational vocational services. They know that their children is in an environment that's safe. So this is a program that allows the women to bring their children with them. They also receive, there's times when a woman, like myself, we don't have such confidence where we could go out and get a job when we're new in treatment, and we have a person that especially does that with them. If you have those fears, then that person will actually assist you by going out with you, basically holding your hand and supporting you while you go out and look for a job or go on a job interview. That's one of the things that this program also does. They receive help with transitioning into the community. So it's not like cut and dry, you get 180 days or 15 months and you go back into the community and make the best of it. No, we make sure that that woman goes into an environment that's safe, that she's able to pay her rent while she's there for those 15 months. She's able to save her money so that she will get a head start into society. And so I just wanted to say that because of the services that we have today, and also want to say one of the things that have changed is that the programs now are gender responsive and trauma informed, and we're learning to treat women in a different way, and also understanding that women have suffered from some very traumatic experiences, and recognizing those in the programs. And those are some of the trainings that we recently went through in the last few years. And as you've heard, it came from some of the people here at this table that we were able to get educated. I know that co-ed services are not good services, so we understand that women do much better when they're by themselves. But I also understand that it's hard for a woman to think about her recovery when she does not have family support and she's separated from her children. So that's another wonderful thing about the programs that we have today for women, that we encourage them to reunify with their family, their children. We make places for them on the weekend where they can come, the children can come and hang out with their mom, even if they don't want to take them out of the safe environment that they're in. Or if they're not in a safe environment, then they get to come and stay at the program with their mom. So that takes away one of the barriers that a woman has. And as a mother myself, my first priority is my child. So when you eliminate that problem for me, it makes me able to achieve much more and to be able to stay focused on the things at hand. I want to say that my heart is full. My heart is full because of the cuts. My heart is full because I think about the women who may not have the opportunity that I received because of the budget cuts. I'm just hopeful that, and I'm grateful for this opportunity, but I'm also hopeful that we could come up with some type of resolution that will allow as many women as we can to receive the services that we have today. And as a result of an in-prison substance abuse program, as they stated, it's important that you do one inside, you get substance abuse treatment inside, and that you're able to practice the tools that I learned in the in-prison SAP. I get to practice those in the community, and that's what the community-based treatment program provided for me. So as a result of that today, Senator, I stand before you a taxpaying citizen. I stand before you a mother. I stand before you a wife. I stand before you a grandmother of 3 beautiful children, and I'm currently in college. And I just want to thank you for the opportunity to share that with you.
Thank you very much. Congratulations. Thank you. David Warren.
Good day. My name is David Warren. I'm appearing today on behalf of Taxpayers for Improving Public Safety. I've been involved in the women's prisons for over 20 years. I started at CIW, where I was asked to leave because I was visiting a very young black girl who had been one of my clients because the visiting room sergeant, who was also black, objected to the fact that a John was visiting a young black woman in the visiting room. I have been involved with CDCR management, sometimes humorously, sometimes for better, sometimes for worse. But what I regret about today's hearing is today in the second row, you have the 6 people, to your right, Senator, you have the 6 people most intimately involved in the women's prisons, and none of them have testified as their individual problems. When I first started visiting CIW, the roofs were on, they didn't leak. The windows were tight, so the cold wind or the hot air didn't blow in. When I started visiting prisons, when Warden Dawn Davidson, who has retired recently, could not find a Jewish chaplain to start the kosher food program, I traveled from Sacramento to CIW to operate that program to make sure it was up and functioning. These people have limitations that are imposed by the budget, over which they have absolutely no control. Senator, you said, what is the problem? The problem is not all CDCR. It's the legislature who for years have piled on new sentences, new enhancements, and have created a board of parole hearings which releases no one, even the dying. As a consequence, we incarcerate people who are no longer a public danger. I would like to close with just one point because, Your Honor, pardon me, I'm sorry, too many years in court, Senator. I think that one of the points that struck me today that is most absent is the faith-based programs operate in our state prison systems. Some of the chaplains, as a result of the number of hours they work compared to their compensation, make less than minimum wage. The recidivism rate for people who are actively involved in religious programs is below 10%, and yet they are considered an afterthought with very little or no funding. What you, I believe, need to address to the other members of the State Senate is the reality of we have tough on sentencing laws. We have the most draconian sentencing laws in some cases, such as for drunk driving, and yet we have this terrible crime rate and recidivism rate which does not relate to the sentencing. Until we address that problem, I don't care how good all these people in the audience are. I don't care about the funding cuts. The population will always exceed the funding. Thank you.
Thank you. And Sean Toner?
Thank you. I'm Sean Toner from Kern Valley State Prison, maximum security for males. I'm here as an educator. I have 10 years. I spent 5 years in public education and almost 5 years now in CDCR. And I have had the privilege of working at North Kern State Prison as well as working alongside elementary and secondary education teachers who are federally funded. I pay my own way when I'm allowed. I write grants for under 21 students. In my capacity at CCWF, which is women's prison, I had the opportunity to work with Heidi. She works with the under 21 prison inmates there. And she had a room full of 30 computers which were full every 2 hours. And what I wanted to say is that, she would probably get 45 GEDs every 90 days. And a woman's prison functions quite different than a man's. And I'm here because women take on education because they know it's their last hope. It's the last ride, and it's the best thing that ever happened, and they take it and seize the opportunity. I wish my adult incarcerated high-risk offenders saw such things, but they're very involved in gangs. And I've had the opportunity of interviewing over 700 under 21 inmates at Kern Valley and North Kern at the reception center. They struggle with drug addictions. They struggle with abuse. They have anger issues. They're impulsive. I am the arms of humanity. I am the only woman some of them will see for 20 years. I've been told that. When they were in programs, I said, how many education classes have you been assigned to? CDCR does a poor job of assigning inmates. 20% right now out of my 54 have diplomas or GEDs. Inmate assignments refuses out of the master plan that they came up with when I came aboard as a new teacher, that we were going to get the right inmate to the right program. I would definitely agree with everything Dr. Owens said about program fidelity. They have broken every rule. And ask the teachers. Don't go to researchers who don't know anything about the prison system or the culture of the prison. There are prison politics at work, and there's not only politics in the prison, there's shot callers teaching those inmates. When I can't get a hold of those gang members, those inmates are out there getting schooled by people out there on the yard. You will see, and I'm going to make a prediction, and when I'm gone, because I'm laid off, so is my husband, and so is 600 people behind me. When I leave, when they start rioting, they're going to want their programs back. And it is a dangerous deal. You guys are playing poker with public safety. And I am not even joking. I'm here to tell you, as a warning, anger management needs to come right back immediately. And I know kids are very important because they're the father's footsteps. You're turning out men who have never resolved their issues to educate the next generation. We have a legacy, a cultural deficit. And we're going to put that not in my backyard policy. It's not going to work. They will be in your area. 300 people in California parole. They will be in our neighborhoods. I've got 2 members of my family that can't have any contact with me. They're under a bridge in 99. There's a chaplain that says, your nephew's doing better. He's been incarcerated 8 times. Went to the parole board. He can't stop using meth. Cannot stop being an alcoholic. He can't be part of any part of our family. So I'm depending on the Department of Corrections and teachers to touch family members because I can't have anything to do with them. So here's the thing. You need to teach people while they're with the prison system, and you need to allow humanity to enter the dark side. Officers do not see prison rape. I've reported 2. It went on for months until I walked up and his jaw was broken and I reported it. We are first responders. We are 911. We are the people you don't want to pull out of the car accidents, and you don't want to see the reports because you'll throw up. Teachers are good for us. I'm a taxpayer. I'm a conservative. I do not spend money on things or waste time and this is so important. It's not my job. It is a legacy. I know when I die, I will have left something better behind me. I will have left students that are teachers. I have clerks and TAs that I train to solve problems in the classroom, gang-related, social issues, interview questions so they can, when they parole, they can go to an interview and sound somewhat intelligent. They have prison lingo they have to get out. They have to learn to speak like the rest of us. They have to learn to act, walk, and not sag their pants. These are gang issues that it's infiltrated. And if we can't get to the bottom of that, we have not done anything. And so I'm not teaching just algebra or essay writing or driver's license training or working with other teachers to solve. I am working with learning disabled. I make the referrals to make sure that they get mental health services. I know they're being used and raped. I know it. I can watch them walk. How often do we walk up on scenes and reports are never made? Well, that officer, they had it in the building. Well, teachers are there. We're saving you money because we're the ones who go to the warden. We're the ones who talk to the people. I see new programs, and let me tell you about the new program that's coming. 200 inmates, they'll be just numbers. I can't sit and talk with them about their life skills or what plans they need to make. So 200 students, each assigned a number, 27 seats, 27 completes. We need to get past these numbers and start looking at people as people. They're not objects. These are the ones who dropped out in 5th and 6th grade. These are the ones who can't even read a medicine bottle to decide what dosage. They are the same people going out trying to help their kids, and they don't know. They don't know you don't put things in the microwave and why a microwave works. They've been incarcerated for 15 years. The world stopped when they went incarceration, and we continued. It is our obligation. It is not what we do today. You can cut programs, but you will see the effects, and you will see it generationally. It will come back. And we won't be just dealing with Dad. We'll be dealing with babies, their babies. And I came out of middle school. I could tell you who was going to prison when they were 13 because Dad was there, and that was cool. So we've got to fight that. And reports for fidelity, geriatric parole. I have several inmates that are 67 years old. They can't walk. They're not a danger to me. I can handle it. The biggest danger is they file lawsuits because they can't get their heart and blood pressure done. They can't get their frickin' dental done. I fight the MTA to refer them. She says there's nothing wrong with them. We have a whole culture of shut your mouth and just do your teaching job. That's why we're leaving. And I'm going to tell you that's the underlying reason today. Because we know 6 years of education, I'm not going to keep my mouth shut. We cause trouble. That's why we're going. And the research does not support what we support, which is humanity, getting people out with real skills, and this put 200 people in a classroom and expect them to come out better is an amazing oversight. Wow. We need to look back at our education. Thank you.
Appreciate it. Thank you. Thank you very much. Well, this has been a learning experience for me, and challenging, to say the least, because we're going to face bigger challenges, not just this current budget year. And we have heard lots of good information today. And by the way, I do want to recognize the wardens that did come up today. Thank you very much for showing your interest in what's going on. Appreciate the time you've spent with us. It's all about us as a society. It's not just segmented into those who commit crimes and those who are on the outside. It's all about us and how we deal with each other. And so this is a step, a beginning step for me. This is the first hearing we're having on this topic of women and children, incarcerated women and their children. A small segment of the population that is in our prisons, but something that I really am committed to trying to fix, because I think we need to do this to try to stop the generational crimes that are committed, trying to put together back lives that for nonviolent offenders should be back out in our communities, not locked up. And for lots of other reasons, aside from money, just because we as a society need to deal more humanely with each other. I look forward to working with you and use the legislature. I mean, we use us too, because we need to know better how to do policy and how we can better work together. And there's been lots of voices today about what happens good, bad, indifferent, but we need to make sure that how we affect each other's lives is very important. And we can use this position, I can use this position as a kind of a bully pulpit. And I do have I'm not a hard stick person, but I'm determined to make sure that we can change some lives for the good. So I appreciate your time today, and I appreciate your efforts. And we know who we're talking about. We know who we're talking about. So we can make these changes, even in these difficult times, because that's the best time to make changes. So I, again, appreciate your being here, appreciate the audience sharing the time with us, and let's go to work. Okay? Thank you.